Okay, the algorithm of the CSF infections. Here is a patient which present with stiff neck and photophobia. If he is suffering from the AIDS and has a CD4 cells are less than 100, so he is most likely suffering from the cryptococcus. There is a second patient who has gone for the camping or hiking, and he presents with a rash which is target-like in shape and having joint pain, might have the facial palsy, and he might remember the tick. That is, the tick is remembered in 20% of the cases. So, if a patient presents with these symptoms and additionally he is having all these things, these additional information are given on the scenario. So, most likely he is suffering from the Lyme disease. The third patient who has gone for the camping or hiking, but here the rash moves from the arms and legs to the trunk. And here the trunk and here the tick is remembered in 60% of the cases. Most likely the patient is then suffering from the Rocky Mountain spotted fever, which is caused by the rickettsia. The third patient presenting with the same complaints and he is having pulmonary TB, like he is having cough, and that is chronic cough. Second, the patient is having weight loss, night sweats. All these are symptoms which indicates the TB. So if a patient present with stiff neck and photophobia and he is having additionally these symptoms, so most likely he is suffering from the meningitis, which is because of the tuberculosis. When we do CT scan of such patient, so we may get a ring enhanced region on the CT scan. In viral meningitis, we will not have some additional information like we have in the Rocky Mountain spotted fever, in the Lyme disease, and in the Streptococcus, or as in the tuberculosis. Okay, if a patient is adolescent and he is having petechial rash along with the stiff neck and photophobia, so most likely he is suffering from the microorganism, which is the Neisseria. So Neisseria infection, that is a meningitis because of the Neisseria, more common in the adolescent, and additionally we would have the petechial rash of our patient. In viral, there are no additional informations. In TB, we would have these symptoms of pulmonary TB in 85% cases, like we might have the post history of TB. So, in such cases, the meningitis is because of the tuberculosis. The third thing is there are two scenarios. If a patient comes to you with the signs and symptoms of the meningitis and he has gone for the campaign, but when you look at the ration, it is a target-like in shape, and he's having joint pain, facial palsy may be present, and he may remember or may not remember the tick. But if these informations are present, so most likely he or she is suffering from the Lyme disease. On the other hand, if the rash of the patient moves from the arms and legs to the trunk, and most frequently the tick is remembered in these cases, so the patient might be suffering from the Rocky Mountain spotted fever, and this is caused by the rickettsia. If a patient is having AIDS and he presents with these symptoms and you do CD4 count of the patient and you found that it is less than 100 cells per microliter, so most likely the patient is having cryptococcus.